Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Sleep apnea is a sleep condition that affects millions of people, and it can have serious health implications. So what is it? How do you identify it? And how do you deal with it? We're talking with family provider, family medicine doctor, Dr. John Apgar about that today. Thanks so much for being here.
Thanks for having me, Melanie.
Yeah, it's a lot of people deal with this. Tell me from the beginning, what exactly is sleep apnea? What's the definition?
Sleep apnea is the most common sleep-related breathing problem that people can have. It is a condition where the breathing patterns are interrupted during our sleep, and so what ends up happening is our body will then start breaking the normal sleep habit that we have to where we're not getting that restful sleep that we should be getting.
Yeah, and we all know sleep is important. What kind of impact can it have on your health?
And so in the short-term aspects, it can certainly affect your day-to-day routines where you're waking up not refreshed, can have a little bit of a cloudiness, sluggish through the day. You can start to experience more issues feeling like you need to take a nap later in the day or actually falling asleep during the day. And so over time, they have seen that there are increased risks of developing more cardiovascular disease, heart attacks, stroke that can come through afterwards.
Yeah, those are a lot of serious implications, but again, you said that is long term.
Correct, yes. And so it is something that, if left untreated, can become very, very problematic.
What are some of the common causes of sleep apnea? I mean, a lot of people say my spouse snores or I snore. Is that the same thing, or is this something much more?
Snoring certainly has a component to it. There are other things that can also contribute to sleep apnea. Obesity is one of the main factors that we see. Having a thicker neck circumference, which can then cause additional blockage to our airway. If our airway is already narrowed, any additional strain on that airway can create that.
What kind of treatments are available to help with sleep apnea?
So by adjusting some of your sleep routines, that can also help. Often if you sleep on your back, that's putting more pressure on the airway. So if you end up adjusting how you sleep to where you sleep more on your side, even elevating the head of the bed a little bit can also help create that airway. They do also make these special mouthpieces that can help shift your mouth forward a little bit to help keep that airway open. One of the other options that's available is a device that actually pushes air into your lungs, keeping that airway open, also known as a positive airway pressure device.
And at what point would you be on that positive airway pressure device? Is it CPAP, is that correct?
Correct, yes. And so in the diagnosis of sleep apnea, the way that we usually check that is through a sleep study. Previously, it had to be done at an outside facility, but here recently they've been developing methods to where you can actually do those tests at home. And through those tests, they can identify if your oxygen level starts to drop below certain points, if you actually have changes in your breathing to where they're more shallow, or you stop breathing entirely. Depending on the degree of or how often those are occurring will also help determine if some of the more mild options as far as positional changes, weight loss, the mouthpieces are available, or if you need to look at the CPAP devices.
That's really interesting to know that there's a home option. It's easier to identify the problem and therefore, in the end, get treatment for it.
Yes,
yeah,
very much.
That's encouraging. All right, Dr. Apgar, thank you so much. A lot of great tips on sleep apnea. Hopefully people will address it and avoid those long-term health complications that you mentioned. We appreciate your time.
Thank you for having me.
Thank you. Thanks for checking in on Monday Health Minutes.